We are going to talk about how to select the right answer every single time when you are in this exam, right? So, this is a complete system to eliminate the wrong answers and avoid the two answer trap. We try to finish this in the next 60 minutes as a master class to help you to choose the right answer every single time. So, this was something, something that happened to me, right? I choose the wrong answer thinking that that was the right answer and I skipped the right answer. And when I took the NPTE, what I understood is that if you could break this two answer trap system, that will be life changing, right? That will be the that one thing that you need to clear this exam. So I knew it was B and I changed it to C, but the answer was B. A lot of times this happens, and if this stop happen, the moment this stop happening, that's where you start to make the real change. So this, by the end of this class, by end of this module, this problem ends today, right? By the end of this hour, you will have a systematic approach, right? That work on every questions that you're going to face in your NPTE. So a 60-minute roadmap map goes like this, right? So this isn't some theory, this is a step-by-step system you will use on every NPT question. So the first 0 to 10 minute, we're looking into the foundation, why you are getting questions wrong, the 5-step elimination system. And then you're looking into the big three framework, the safety, the effectiveness, evidence hierarchy, and 4 detailed practice questions. 25 to 40 minutes we're looking into the elimination mastery, thinking how can we eliminate these wrong answers so we end up with the right answer. So there's 9 specific elimination rules, the language pattern recognition, and 4 more questions. And when we come to the 40 to 50 minutes, we're looking into 2 answer trap drills, where we do 6 tiebreaker strategy when stuck between 2 answers and answering 4 advanced questions. By 50 to 60 minutes, you are using an execution strategy. You learn how to do this execution strategy, your personal checklist, exam day stamina training, and final integration. So let's get into it, the free masterclass. So the first foundation. First, we need to understand what is going wrong. Why you are getting the questions wrong. So, if you want to make real changes, you need to address things brutally honest, right? And addressing the things that brutally honest and making a change from there will have bigger impact than anything else in life. When things go wrong, or things don't happen in the way you want, you choose to point fingers at others. Instead of that, the moment you change this like this, that's where the real change happen. So let's be brutally honest about what's happening, right? So you read the questions and immediately you jump to an answer. And what happens is when you do an immediate decision making without the proper technique, you eliminate the obvious wrong answer, right? Usually 2 out of the 4 one. You eliminated the, let's say you eliminated 2 1 and you left with other 2 ones. So you stuck between the two that both seem right. You pick based on gut feeling or what seems more familiar to you. And you get it wrong 40 to 50% of time when it comes down to that 2 answers. So the problem here is that you're using random guessing when you should be using a systematic elimination. So guessing has a 50% success rate, but our system has 90% plus success rate. So the 5-step elimination system, right? Your new default process. So from this moment forward, you will approach every NPT questions using these 5 steps in order. No shortcuts, no skipping steps. So the step 1, I want you to put this in your brain, ingrain this brain that when you see this question, this is the elimination steps that you need to go through to get to the right answer. So the step one, you need to read the last sentence first. So the question systems tells you what the NPT wants. Look for the keywords, right? Let me put this in a view. Let me see if we can mark. So the first you need to read the questions, and you need to read the last sentence first. So the question stems tells you what the NPT wants. Look for keywords most appropriate, right? It will be end up with what is the most appropriate intervention, or it will be initial intervention, or it can be what will be the first action, or it can be the primary concern. So you need to focus on the last part of the question first. Example, what is the most appropriate initial intervention? This tell you to prioritize the first line, conservative and safe intervention. When you think about the initial intervention, you're thinking about the most safest. So when you think about NPT, this is a basic level, entry level exam, and here you need to look into the safest option, not the most flashiest option, but the safest option. So here you're making sure the patient is safe, and at the same time you're protecting your license. So it's always safety first, right? So what is the most safest, most conservative and first liners treatment? That is what you need to see in the question. And when you come to the step 2 of the clinical reasoning or the elimination process, is that you need to identify what is the critical data in it. So NPT tried to hide the critical information in a case scenario. So it's your job to scan it and get what they are actually asking for. So you need to look into if they are asking for vital signs, time frames, whether acute or chronic, or if this question scenario talk about the it doesn't give any idea of the severity of this issues, or there is any contraindications, right? And patient's goals and past treatment failures. So it's very important that it not just in the questions, in life also, to understand what is the critical most important things that you need to capture, right? So first you read the question, you got the last sentence, then you are scanning for the most critical data that they are giving there, or information that hides in the questions, and then you're coming into step 3, that eliminate the absolute wrong. So this is a common sense, right? When they give you 4 options, in the first 5 seconds of once you see that options, you already know that 2 of these questions are no way going to be the answer, right? So use the 9 elimination rules, which will be detailed in part 3. You need to stick till the end to get that. But so to immediately remove the first and 1 to 2 options, you need to do the elimination rule. So there are answers that contraindicate the scenario, or these are the answers that violate the safety or outside the scope. So what happens is, if you already know that if I do this treatment, it's a contraindication in this case, you already know you need to take that off, or it is safety of the patient is violating by this answer, you can take it off, or certain things are outside the scope of your practice, you need to take it off. So the elimination rule need to be used to get these 2 answer that is no way can be the answer. So you're left with the 2 answer, and that's what I call the 2 answer trap. So that's step 3. Now you are coming into the step 4. Apply the big 3 framework. So now you're down to these 2 answers. This is where 90% of students start guessing, looking for the gut feeling. So you won't ask which is safer here. If it tied, which is more effective? If it tied, which has better evidence? So that last 2 answer trap, but now both look pretty good answer, right? They two both can be the right answer. Now what you are doing is you're seeing is which is safer in between this, which is more safer. So if they become tied, you see which is more effective, and now it's more effective which has more evidence. You see that? So it can be both right answer, but which is more right? That is what you need to see when you come to that two answer trap. Now, this tip alone will raise your score by 10 to 15 points. Look at that. If you get this thing right, how to choose the last from the two answer, the right one, you're going to get this on the first time itself. Step 5, using the tiebreaker strategy. Now, what do you mean by that? So if you're still stuck, it can happen between 5 to 10% of the questions. You use the 6 tiebreaker rules, which will be detailed in the part 4. So these handle edge cases where big 3 doesn't immediately clarify. So some questions seem so hard to the point that you don't really get whether they're asking for ortho, neuro, cardio, or everything together. So then you need to use some other technique, which is a 6 tiebreaker rule. And so these are your nuclear option and use only when needed. So these, if you have this step 1, 2, 3, 4, 5 in your process flawless and effective and efficient, you're going to master NPTE every single question. So from this moment forward, you will approach every NPTE question using these 5 steps in order, no shortcuts, no skipping steps. So commit this to memory, right? Read the questions, find you are reading the especially the final part. You will know what they actually want from you. And then you're finding the critical data. You're scanning and see what is the critical data information provided. And then you're eliminating the obvious one. Out of the 4, you already eliminated 2. Now you're left with the 2. There you're applying the big 3, ortho, neuro, cardio, right? And you're seeing which one will be the most right one. Now, even then, it can be still, look very similar, and it can be a tiebreaker. So there you are going to use the 6 tiebreaker strategy, and you're going to end up with one answer, and that will be the right answer. And if you choose this right answer every single time, you're going to clear that exam on one try. So when you talk about the big 3 framework, this is the heart of the system of NPT. So I want you to memorize this hierarchy, use it on every two answer trap. So what do I mean by a priority hierarchy? What is the most important stuff? And when you see here, you will understand the number one priority here is safety. Patient safety always wins. So ask, could this intervention harm the patient given their current status? Right? So it can be, when you think about safety hierarchy, you are thinking about vital sign abnormalities or recent medical events like stroke, MI, surgery within 48 to 72 hours, or you're thinking about absolute contraindications like exercise with unstable angina, mobilization with unhealed fracture, or is there any fall risk factors without proper precautions. So there are symptoms suggesting serious pathologies like chest pain, severe headache, or bowel and bladder change. So if these red flags are there, or something that showing you changes with the vital signs, that is, it's affecting the life itself, and there's absolute contraindications. If these things are there, you need to understand that safety is the highest priority, and you need to choose the one which is the safest option. So if one answer has any safety concern and the other doesn't, choose the safer option, period, right? So I want you to ingrain this in your brain. Always, I need to choose the safest option. Now you're coming into the effectiveness. So most direct path to the primary problem. Other concept in life also, right? You need to choose the safest and easiest way, most direct. Don't want to go all this way. Sometimes we try to be over smart, right? We want to make things more complex and think the story that you are not mentioned. You're thinking you don't want to do that. You want to make it so simple. What they are asking, you just give it, right? Prime. right back to the primary problem. If both options are equally safe, you need to ask which intervention most directly address the patient's primary impairment or the functional limitation. End up with the last two answers. Both are safe option. Now what will you do? What is the primary impairment or functional limitation that you need to address? So effectiveness principle says that specifics beats general. Strengthening weak muscle greater than general conditioning. Casual beat compensatory. Fix root cause, work around it. Functional beats impairment level when patient is ready. Gait training more than isolated strengthening. Progressive beats static. Advancing intensity more than maintaining plateau. So the idea here is that intervention that most directly resolve the primary problem win over one that help indirectly or addresses a secondary issue. So it's always looking into what is the safest option and what is the most easiest direct path to address that concern, right? So win over that helps indirectly or address a secondary issue. Then you're coming into what is the most researched backed intervention. So you think that both are safe, both answer is safe, you think that both are effective, and then you're coming to the in between them which has the most evidence. So if both are safe and equally effective for the primary problem, ask which intervention has the strongest evidence support. So in the evidence hierarchy there is high to low. So systematic review, meta-analysis, random RCTs, clinical practice guideline from PT organizations, expert consensus, and clinical tradition, which is the weakest one. So NPTE favors evidence-based intervention over what we always done, right? If an answer includes outdated techniques, ultrasound for everything, aggressive stretching for CP, and it's usually wrong. So you need to look into safest option, what is the uh, direct path to address the primary concern, and which has the highest evidence. So that will be the way to choose your ransom based on the priority hierarchy. Okay, so to get this into its essence, we tried to clear this one question. So a patient who experienced a left MCS stroke 36 hours ago demonstrated right-sided hemiparesis, right homonymous hemianopsia, mild expressive aphasia, with the current vitals blood pressure of 168, 94 milligram Hg, right, and heart rate of 88 beats per minute and respiratory rate of 16. So O2 saturation of 96% on room air. The patient is alert but require moderate assistance for blood mobility. The patient's goal is to return home independently. What is the most appropriate initial physiotherapy intervention? Right. So when you read this question, you are using this technique on solving this issue. So there's four options. Let's see. So the therapeutic exercise focusing on right upper extremity at your range of motion strengthening, or bed mobility training with a focus on compensatory strategy for paralysis, or you can defer PT intervention and notify the medical team about the elevated blood pressure. Visual scanning training to address the right homonymous hemianopia. So if a questions like this come and there's an option like that, how we are going to use the 5-step system. So you need to read the question, right? So you need to look into the last part of the question and see what they're asking. They're asking for the most appropriate initial physical therapy treatment. So what is the most appropriate and initial? So the keyword most appropriate initial intervention, this signals we need the safest and most appropriate first action, not the ultimate goal intervention, right? So you need to look what is the first step, what is the first stage of intervention that you're going to choose, not the last. Step 2, you're identifying the critical data. Okay. You need to look into the time of this, right? Left MCA 36 hours ago. I wrote in red for a reason. This is hyperacute phase, very high risk period. BP 168.94 milligram Hg, which is elevated. Normally is 140/90 based on the new protocol, especially critical, especially for a post-stroke patient. Now he has an impairment of right hemiparesis, hemianopsia, mild aphasia, and functional status, needs mod assist for bed mobility. I mean moderate assist for bed mobility, right? So this is the critical data you should be getting from reading this question. So first you're looking at the last part of the question, you're understanding what is the most appropriate initial intervention, not go for the last one, and then you're seeing what should be the critical data, what is the vital sign says in here, what is the red flags, what should be the things that I should be looking into, I should be aware about, what is the information I should be looking into here, high priority data, right? So that's the critical data. And then you're looking into step 3, which is eliminate the obvious wrong answer. The option A say therapeutic exercise focusing on right upper extremity wrong and strengthening active range of motion and strengthening. So not wrong per se, but not priority. It is not an initial priority. Could be appropriate later in the stages, but we safety concern need to be addressed first. Now, other one is visual scanning to address right homonymous hemianopsia. Like a patient whose BP is this high, a patient who is in a very acute stage of stroke, the focus should not be balance training. So we are taking out, obviously the A and the out, they're gone. Now you are left with B vs C, right? These are the two options that you need to choose. This is called the classic two answer trap. So if you're choosing an answer between these two on a gut feeling, the chances of you getting the answer wrong is very high. Now, when you come to this last two answer, you need to apply the big three framework which we taught. So option B talk about the bed mobility training will increase BP further. Patient is already at 168/94. Physical exertion is in acute stroke. The elevated BB risk hemorrhagic transformation or infract expansion, which is not safe. So when you're looking at the safety, B already gone, right? So when you look at the three priority, you're first looking at the safety. Is this effective? And is this evidence? So safety, when you look in the safety, it's already gone. Now option C, defer the treatment, notify team, no immediate risk to patient, medical team can manage blood pressure before PT start, which is the safest option. So based on the three big safety, you're looking at the effectiveness, and then you're looking at the research. When you look at the safest option between the last two answer, you came down to option C. So the correct answer is C, safety always win. When initial signs, when the vital signs are abnormal in acute condition, medical stabilization precedes PT intervention. The NPT will fail you for choosing functional training over safety screening. So always keep this in your mind, in your real life, and ingrain this in your heart. Safety is always way. Now, why this trapping students? So why this traps you? So in real clinical practice, many therapists would proceed with a gentle bed mobility. The BP is elevated, but not in hypertensive emergency territory. 120 or above, 120 bar 120, 190 bar 120. So you might monitor vital and continue carefully, but NPT tests the best practice standards, not the common practice. So the evidence is clear. Elevated BP in a hyperacute stroke require a medical management first. This is a known when not to treat question, right? So know when not to treat is the biggest thing you should know. You know, this is called knowing what to do is knowledge. Knowing what not to do is wisdom, and that's what they are looking. Okay, we can look into another questions. We are looking into the second practice question, right? A 52-year-old recreational tennis player presented with a chronic shoulder pain, with the clinical finding of positive drop arm test, significant weakness in external rotation, and empty can test is positive, full passive range of motion in all plane. And here put no night pain, but MRI revealed there is a full thickness supraspinatus tear with moderate fatty infiltration. The patient report difficulty with overhead activities but can perform most activities of daily living with modification. Conservative management include 8 weeks of physical therapy focused on the rotator cuff strengthening and scapular stabilization has failed to improve symptoms or function. What is the most appropriate recommendation? So you will need to again use the 5-step system, but before that we need to look into the options. So continue progressive resistance training with emphasis on scapular stabilizers and compensated strengthening. Or you can recommend any surgical consultation for rotator cuff repair evaluation. Implement a comprehensive scapular disc kinesis correction program with the biofeedback, or you can give a trial corticosteroid injection followed by another 6 weeks of modified physical therapy. You are looking into what is the first stages of 5-step system that we are using here. The first one is you need to understand, looking at the most, so the end of the question, right? What is the most appropriate recommendation? So the most appropriate next recommendation, because they already tried the stabilization and it's now not showing us if it should be. So most appropriate next recommendation, this is asking what should happen now given that patient has already been tried. So since already patient tried, what the patient report difficulty with oral hygiene can perform most ADLs with modification. Conservative management include 8 weeks of physical therapy focused on rotator cuff strengthening and scapular stabilization has failed. So the scapular stabilization protocol has failed for this patient. Now they are asking what is the next most appropriate recommendation for this client, right? So that is what they are asking. Now once you understand what they are asking, you're asking looking for the critical data in it. So it says there's a full thickness tear with a 2 centimeter retraction, which is a large tear. Then there is a moderate fatty infiltration, right, which is irreversible. And then there is an 8-month chronic plus 8 week of failed PT conservative treatment, which is failed. So functional deficit persists, right? That is a story says that difficulty with overhead activity is still there, and is 52-year-old active, good surgical candidate. So this is the critical data you need to have. There's a full thickness here, and he has a moderate fatty infiltration, which is not, which is irreversible. And this is a chronic 8-month and 8 week of failed physical therapy, conservative management. Now, once you're done with that, you're going into the next step. So here the number is not right, but 5, 6, 7, 8. Eliminate obviously what is obviously wrong. So the option C, it says that, so sorry for the numbers and the here, so scapular dyskinesia program, this is more PT. We already failed 8-week scapular focus program. Adding biofeedback won't change a structural pathology. So since you already know that this scapular dyskinesia with the biofeedback, so already done the stabilization thing and that is failed, so there's no point in adding that again. Option D, you're giving an injection and then giving more physical therapy, right? So basically giving the same thing again with the corticosteroid. Corticosteroid injection might bring the inflammation pain down, but it won't help with the full thickness tear. That's gone. A full thickness tear with the fatty infiltration, this is delaying the definitive treatment you need to eliminate. So once you eliminate the most in obvious one, you're left with two options. Now from this, what will you choose? So now you're left with continue progressive resistance training with emphasis on scapular stabilizers and compensatory strengthening, or recommended surgical consultation with rotator cuff. So when you have a complete tear and the patient's age is, in a way that he's looking healthy for going for an what do you say, surgery, what you going to do? So here then you're going to apply the big three. What is the big three? Safety, right? What is the most straightforward, the primary treatment, or what is the which one has the highest evidence? Now, option A, more PT. Can compensatory strengthening really help? Sometimes, yes, but partial tear or in initial cuff with weakness. But full thickness tears with the fatty infiltration has poor prognosis for conservative management. The structural damage is too severe. So PT can reverse fatty infiltration or reconnect torn tendons. So a physical therapy treatment at this stage is not effective to restore the function. So option B will be the best option. You need to go for a surgical consult. That is the most safest, right? Most effective, and that will be the most research backed option. So surgical repair can reconnect the tendon, restore some function, prevent further fatty infiltration. Evidence show best outcome when surgery is performed within 6 to 12 months of tear. We are at 8 months, still in the window. Most effectively address the structural problem will be what? A surgery, right? So winner will be option B by effectiveness, level 2 of big 3. So you're looking for safety, right? You're looking for effectiveness here because both A and B are safe. Patient is not in a danger, so you're going for the effectiveness. Now, if effectiveness fail, you're going for what? What is the most researched backed thing, right? When conservative management fail for structural pathology like full thickness tear or fatty infiltration, the NPT expect you to recognize your limitation and refer appropriately. More PT is not always the answer, right? Now, why is this a trap? As a PTs, we want to believe we can fix everything with exercise and manual therapy. Choosing more PT feels like we're doing our job. Choosing a surgical referral feels like we are giving up or admitting defeat. But professional competence includes recognizing when PT has reached its limit, right? You need to understand that certain conditions or cases, you're going to reach a limit, you're going to plateau, right? That's the time you need to refer, right? So NPT test that's this specifically with the failed conservative management scenario. Keyword to watch, you need to look into failed, no improvement after X weeks, fatty infiltration, full thickness, persistent system despite PT. That means, the PT management is failing. So you probably need to refer. So that is the right option you need to make. Okay, so now we are entering the part 3, the 9 elimination rule. If you have mastered this rule, you're going to get the answers right every single time. So the mastering the system and the elimination rule, okay? So these rules will help you eliminate 1 to 2 answers immediately, getting you from 4 options down to 2 in seconds. Elimination rule number 1, right? Contraindication rule. If an answer choice includes an intervention that is contraindicated, given the patient's current status, eliminate it immediately. Now, if you know something is a red flag, something is contraindicated, and that is there in the option, you need to eliminate it, right? It's so simple. So common NPTE contraindication traps include exercise with unstable angina or within 48 hours of MI without clearance, weight bearing on unhealed fracture or recent surgical repair. You need to always look into the precautions that is given by the physician, right? You need to look into range of motion exercise into direction of recent dislocation. Respect the post-operative protocol. Very important in very important in rehabilitation. Okay, if there's a physician who did the surgery tells you to not do a certain movement, you don't want to do it, right? So manual therapy over unstable fracture, tumor, infection, or acute inflammation. So you don't want to go and do your manual therapy over, an unstable fracture, or there is a tumor, or if there is an infection, or there is a very acute inflammation. Then aquatic therapy for open wounds or uncontrolled bowel and bladder. Mobilization in hypermobile and unstable joints without stabilization first. So if there is a joint hypermobile, you don't want to go mobilize that. So these are some common contraindications that make common sense to everyone, right? So if you know that that is a contraindication and a red flag, and there is that as an intervention option in the option, you need to take it off. That's elimination number one. Rule number one, always take the contraindication out. Elimination number two, timing and sequencing rule. So if the question asks for initial or first intervention, you need to eliminate the answers that represent advanced or later stage intervention. So this can happen multiple times in the question. You need to look at the end of the question and says, what will be the initial treatment that you go into this patient? You don't want the end goal, end treatment, right? What is initial? So assessment before intervention can treat what you haven't evaluated, right? So you always thinking about a clinical hierarchy that is always remaining in your head even after completing this exam. Okay, screening before specific treatment. Rule out red flag first before you start for a treatment. Pain inflammation control before aggressive strengthening. You need to always control the pain and inflammation before you go into any kind of strengthening. You need to range of motion before strengthening. Can strengthen through range of motion if you don't have it. Stability before mobility. You need to always look into proximal stability for distal mobility. Component skill before complex functional task. So it's always the foundation and then build on top of that. You build the base and then you build top of that. That is the rule of life. That is the rule of the game. That is the rule of treatment, or you do anything, you need to have that idea. So without assessing what you're going to treat, don't even touch the patient if you don't know what's going. And before you do an intervention, you need to see for red flag. And without good range of motion, you're not going to build a lot of strength there. Without stability, there's no mobility, right? Now, we're trying to put this into practice. When you apply big three and you're still genuinely stuck between two answers, this happened to 5 to 10% of question, use these advanced tiebreaker, right? Now, what do I mean by tiebreaker? So always conservative beats aggressive. When both answers are safe and effective, usually NPTE favor more conservative approach. This means less invasive, lower intensity, lesser risk. So you're looking for the safety, right? Always number one, effectiveness. You're looking for what is has research back, and then you're seeing is this one idea that what is the most conserved way of doing things, especially when you're young, especially when you know that early stages of rehab. You're like, oh, I'm so interested. I want to do this. I want. Oh. You're so impulsive when you make these decisions, and then you regret later in life. So sometimes you need to slow down, back off. So you need to have this conservative idea or approach instead of the aggressive high intensity exercise. Okay, so choose the one that is more conservative, more safe. So example, education plus home exercise will be better than aggressive hand-on treatment when both are seems appropriate. Observation and monitoring is better than immediate intervention when severity is low. Gradual progression better than rapid advancement when patient is stable. Non-pharmacological better than pharmacological recommendation. PT stays in scope. Right? So always what is the most conservative, what is the safest, less risk. Choose that. That will be the tiebreaker if you comes with the last two options. That is both effective and both safe. Now, Another tiebreaker you can use is you need to always look into patient-centered beats therapist-centered. If one answer empowers the patients, education, self-management, activity participation, and another keep them dependent on you, like passing modalities or hands-on, you need to choose on patient empowerment. A lot of the time, we think that we need to teach them something, we need to dictate our style. No, don't want to do that. Patients, when you talk to patients, you know what they actually want from you. You need to only give what they want, right? If one answer empowers the patient and educate and self-management, give that, make them independent, not dependent on you. So patient-centered wins, teaching the patient self-stretching better than therapist performing stretching. You need to give active exercise than passive modalities. Home exercise program, clinical dependent treatment, patient education on self-management, then creating dependency on PT. Okay, now we are entering into the personal execution system. Okay, so this is a one-page cheat sheet. You need to memorize this and print this, keep it in you during every practice section. Within 2 weeks, it will be automatic. So your PT answer selection protocol, use this on every single questions that you're going to. Okay, step one, read the question. Stem first, right? What is a stem? It usually comes at the end of the question. That look for the most appropriate initial first primary. That end part mention what they actually want. Now you're scanning for the critical data. What are they saying? What about vital signs? What are they saying about contraindication? Are they going under any kind of red flags, past failures? Look into that critical data. Once you're done with that, you're coming into eliminating using the 9 rule. So elimination rule, which we'll be talking later a little more. We only gave you I know two, but we will give it to you later. Okay. From 4 options, you come into 2 options, and less than 5 seconds, you can choose in between that 2 options. Now, step 4, applying the big three. Safety, right? Does this option between these 2 options, which is the most safest? If you feel that both is safe, you look at effectiveness, which is more effective. Address the primary problem. Both address the primary problem. Okay, now we are coming with what? Evidence. Which has the biggest evidence? Okay, now you know that evidence is also similar. Even if then you feel that between these two you have doubts, you're going to use tiebreakers, right? Conservative always beat what? Aggressive. Patient-centered always beat therapist-centered. Specific beat general. Current decline beat tradition. Known beats unknown. Collaboration beat solo. So never guess. Always use the system. Keep this in your brain, heart, I don't know, keep this printed, stick it in your head, forehead, whatever. This system is going to help you like nothing else for clearing this NPT and getting the life that you always dreamed about. All these years of hard work, all this work come down to this clinical reasoning method will really help you, because it helped me.